So, first of all, what if like a cancer patient came to the ER? What do we expect that he is suffering from? The first thing you expect is neutropenic sepsis. So why should we expect this thing exactly? Because when you most of cancer patients are under chemotherapy. Chemotherapy is trying to kill those rapidly dividing cells, which are the tumor cells. On the other hand, what chemotherapy does is killing our healthy cells, such as the bone marrow cells that are always trying to do blood cells. What else? The mucosa, the epithelial, because those are rapidly dividing cells. So chemotherapy not only kills the tumor cell, but also our healthy, rapidly dividing cells, causing myelosuppression, which is bone marrow suppression. Our bone marrow now is not being able to produce enough cell, and also a mucosal injury. Our mucosal cell that protect our gut now are injured. So what problems this could cause? First of all, myelosuppression will lead us to low blood count, either white blood cell or red blood cell. Our concern now is white blood cell, including neutrophils. Neutrophils are very important in order for our body to fight bacteria, right? Now I don't have neutrophils because our bone marrow are not able to produce enough of them because it's being suppressed by this chemotherapy. I don't have enough neutrophil. This is called neutropenic. This patient is neutropenic, does not have enough neutrophils. What other thing can this chemotherapy cause? It can cause this mucosal injury, right? We know that there is normal flora that is living in our gut. We are okay with them. They are giving us vitamin K, which is important for our body to keep hemostasis in our blood, so we don't bleed and so on. So we live with those normal flora, which are bacteria. But once there is epithelial injury, those normal flora can go and travel through the blood, right? And now I have bacteremia. Is bacteremia something good? No. Bacteremia cause sepsis. Whenever the bacteria is in the blood, we are so afraid of it. Why? Because it could release some endotoxins, exotoxins. Those are bad chemicals that can disrupt our blood. So this is neutropenic sepsis in short. So what is the definition now that the slide is trying to tell us? Neutropenic sepsis is defined as a single temperature of 38.3 Celsius orally, or temperature of 38 or more orally, lasting an hour in the presence of neutrophil count of less than 500 microliter or less than 1000 microliter, and a predicted decline to less than 500 microliter over the next 48 hours. So in short, he's trying to tell you, if a patient come to the ER, if a cancer patient come to you, you know he is in chemotherapy and his temperature is 38, okay? And you did a CBC or full blood count, and you find that the neutrophils are less than 500 or they are less than 10,000, but you expect that by 2 days he will get them even less than 1,000. Okay, now you will say, okay, this patient might have a neutropenic sepsis. Okay, so definition, and you have 500, less than 500 neutrophils, and temperature. Okay, if you don't have this high temperature, you may have those signs and symptoms of sepsis. What are the signs of symptoms of sepsis? You might have hypotension. This is one sign of sepsis. Go look for it, because I'm not going to tell you something I don't know about. I read about it, but I forgot. But go and look for signs and symptoms of sepsis. But in general, why sometimes patients do not have the temperature? So temperature indicates usually there is like immune response. So if those patients are already immunocompromised, are their body able to cause an immune response? It might not. So that is why if there is no temperature, you don't just feel like, okay, it's not sepsis. No, because he is immunocompromised, okay? You should go and look for other signs. And one important sign is hypotension. Okay, so how can I manage this patient? Immediately give him a broad spectrum antibiotic that work against gram-positive and gram-negative and anaerobic bacteria, okay? So without the administration of timely antibiotic, mortality may be higher, because if you didn't give him this antibiotic, he might die directly, okay? So what are the principles? We need to assess the hemodynamic status. What are the hemodynamic status? We need to see the heart rate, the blood pressure, the cardiac output, the stroke volume, all of these heart-related things. We need to make sure that they are stabilized, okay? And you need to look for the source of infection. For example, he has some burns, he has some injuries, or even like central line that could be a source, maybe because he's susceptible to something from the outside enters his body. But usually with cancer patient, we don't see like symptom, we don't see those signs like on his body, because the problem, as I told you, is inside his cells, his gut cells, his mucosal gut cells is being distracted, so the bacteria might come from inside, okay? Investigation including full blood count, electrolyte, liver function test, blood culture, because we need to know what organism causes this sepsis, right? You can take this blood culture either from periphery, it means that you take from peripheral veins, or if he has like a central veins device or catheter that he used for administering drugs or so on. It's like this one, I'm gonna show you. So central line is like this one, okay? This is a central line. So some patients have this central line because maybe they used to take drugs by this central line. Okay, where are we? Okay, so coming here, what else do you need to do? You need to do chest x-ray to see if there is any like pneumonia or like infections in his lung, signs of infection, because this is a vital organ, important organ, the lung, okay? You also need to do a urine analysis and culture. You need to know if there is like any, what type of bacteria he has in his urine, and urine analysis maybe to assess the kidney function. Okay, so antibiotics need to be able to cover a broad spectrum of organism, including gram-positive, gram-negative, and organisms of anaerobics, as I told you. Because of the risk of pseudomonal infection, agents covering this organism are administered either as a single agent, pseudomonal penicillin, or fourth generation cephalosporin, or in combination depending on the institutional protocol. So we know that people, for example, with leukemia are at high risk of taking this pseudomonal infection. It's a type of organism specifically, okay? They are in high risk. So we have to give them an antibiotic that is specifically working in this organism, or fourth generation cephalosporin. You go to your institutional protocol and you see what you have to do. Do not go to Google. Maybe they will punch you for this. You go to your protocol that is that your hospital follow, and see what to give. Is it combination? Is it only one agent, or only fourth generation cephalosporin? Okay, so when there is hemodynamic compromise or risk of MRSA infection, appropriate anti-MRSA therapy is necessary. So MRSA is like not normal bacteria, it's superbug. It's a very dangerous type of bacteria. So if you think, if the patient, was hemodynamically unstable, his blood pressure is pretty much low, and you suspect he's not that stable, you should use all the resources that you have. So you give them MRSA antibiotics. So what is MRSA? It is methicillin resistant Streptococcus aureus. We use specific antibiotic for this bacterium, okay? So, some low risk patient, if the patient was hemodynamically stable and you feel like, okay, I can wait the investigation, you give them oral antibiotic and wait for the culture result, blood culture and urine culture, until specifying the appropriate antibiotic agent. Okay? And you should give them you should put them in isolation beds. Why should I put them in isolation beds? Because I don't want them to spread the infection. Okay, so note here, for note, granulocyte colony stimulating factors usually do not improve the outcomes in neutropenic sepsis. Why? Because firstly, this is an emergency. Secondly, those patients might be they might have myelosuppression, bone marrow suppression. So granulocyte colony stimulating factor might not work as faster as you want. So you have to deal with those bacteria first. Okay.